Hi guys, Tara here with Good Ingestions. A couple of months ago, I made a video on the stretches I do for my spinal stenosis. Eating non-inflammatory foods, aka whole food, plant-based nutritarian, and doing these stretches on most days keeps me pain-free and allows me a full range of motion. I'll post a link to that video in the description box below. After watching that video, a viewer who knows that I've also dealt with lower back issues commented that she would like to know how I keep my lower back pain at bay. So that's the topic for today's video. For years I've had issues with lower back pain. The slightest bend or twist could cause spasms that would keep me incapacitated whether or not I saw a chiropractor for about 5 days. The doctor recommended back surgery, but I insisted on trying physical therapy. I had an excellent physical therapist and I learned a lot from her. I was diligent about doing the exercises and graduated from the 6-week program in 4 weeks. I found though that if I didn't keep the stretches up on a smaller scale on a regular basis, that the spasms would return from time to time. I decided at that point to make them a part of my daily routine. You should know that I'm not qualified to give medical advice. These are just the stretches that I do to remain flexible, keep back pain at bay, and keep the spasms from recurring. And now for the disclaimer. About 80% of adults experience lower back pain at some point in their lifetimes. In looking at studies on back surgery, depending on the sources, there is a failure rate of 20 to 40%. Some say 50%, while others say up to 74% of back surgery failure rate. So before I get into the stretches, here are 2 very important points. Number 1, if you have acute back pain, spasms, or injury, you should wait to do stretches until you are able to function at a reasonable level. Otherwise, you could aggravate the area and make the condition worse. 2, if you are currently experiencing lower back pain but are still able to function, do only the stretches that require you to lay on your back for the first week or 2. Save the strengthening exercises for when you're more flexible. My protocol when I was in therapy was to do 3 sets, 3 times a day, plus 40 minutes of moderate walking on the treadmill. Now for maintenance, I do 1 rep, 1 time a day, plus a 20-minute walk, usually outside. I learned most of these stretches and strengthening exercises from my physical therapist and some from fitness instructor Denise Austin. I'll demonstrate them in real time today in case you want to try doing them with me. These first exercises are to stretch out the tightness of the lower back muscles and create more flexibility. Begin by laying flat on the floor with your back flat, the curve of your back flat against the floor, arms at your sides and knees bent. With both hands, clasp your right knee and bring it in toward your chest until you feel a gentle stretch, and hold for a count of 10. Release your knee, lower your foot to the floor and relax. With both hands, clasp your left knee and bring it in towards your chest until you feel a gentle stretch, and hold for a count of 10. Release your knee, lower your foot to the floor and relax. Now clasp both of your knees and pull them in toward your chest until you feel a gentle stretch, and hold for a count of 10. Release your knees, lower your feet to the floor, and relax. Next, straighten your right leg. Take your right arm and pull your left knee across your body to the floor. At the same time, extend your left arm straight out and hold for a count of 10. Then go back to center with your back flat on the floor, knees bent. Now extend your left leg and with your left arm, pull your right knee across your body to the floor and extend your right arm straight out for a count of 10. Go back to center with your back flat on the floor, knees bent. This next exercise is not difficult, but may be challenging to do it correctly in the beginning. Using your abdominal muscles, pull the pelvis up and raise the lower back off of the floor. You want to concentrate on using only your abdominal muscles for this exercise. Keep your leg muscles and feet relaxed. Again, we're not using our leg muscles or our feet, but focusing on our abdominal muscles. Hold for a count of 10. In the beginning, this is enough of a stretch to be helpful. As you advance, move on to this next strengthening exercise. Pull your pelvis up using only your abdominal muscles, then holding that position, raise your right knee and then your left knee. Lower your right foot to the floor, then your left foot to the floor, and relax. Let's try it again. Pelvis up, right knee up, left knee up, right knee down, left knee down, pelvis up, right knee up, left knee up, right knee down, left knee down. We'll do this 5 times. This is a great strengthening exercise for the lower abs, and when lower abs are strong, it takes pressure off of the low back. These next exercises are to strengthen the curve in your lower back and push the discs back in, if you will. You want to roll onto your tummy and with your arms bent at your sides, lift your torso up off of the floor, relaxing everything below the shoulders. Just let it droop. Hold for a count of 10. Imagine your discs being pushed gently back into your spine as you do this. Now lower your torso back to the floor and relax. Next, lift your right leg up off of the floor toward the ceiling and hold for a count of 10. Then repeat with the left leg, lifting it up off of the floor toward the ceiling and hold for a count of 10. Next, lift your right leg and the opposite arm off of the floor toward the ceiling and hold for a count of 10. Then switch. Lift your left leg and your right arm up off of the floor toward the ceiling and hold for a count of 10. Lower and relax. Now, lift yourself up onto your hands and knees. Again, lift the right leg and the left arm, stretching them outwards, and hold for a count of 10. And switch. Lift your left leg and your right arm, reaching and stretching outward, and hold for a count of 10. Lower and relax. Next, we want to stretch the upper back. So placing your arms way out in front of you on the floor and push down, strengthening the lats and stretching out the upper back muscles. Next, curve the spine, arms stretched way out, and your head almost touching your knees. This is called child's pose in yoga. Relax into this stretch for a count of 10 or longer if it feels really good. This is stretching the lower back. Now we want to stretch the middle back by reaching the right hand under and across, and hold that pose for a count of 10. Come back to center. Take the left arm and reach through the other side, holding for a count of 10. Then come back to center. And we're done. I always feel more limber and a little bit stronger after doing these exercises. Regular stretching is good to do even if you're not experiencing pain, to stay flexible and keep limber, making everyday movement easier and more fluid. Well, I hope you found this video helpful. If you did, give it a thumbs up and be sure to subscribe for more videos. Click the bell button so you get a notification every time I upload a new video. Share it with your friends so they can benefit from the information as well. Thank you so much for watching, and remember, the road to health is paved with good ingestions and healthful movement. See you next time.